Welcome to NCLEX Strategies. In this video, we are going to study out various strategies to help find the correct answer and eliminate the wrong options. We will study the strategies, followed by example, and then with practice questions so that you would become confident in use of these strategies in real exam scenario. Practice with the use of these strategies will help you locate the obvious right and wrong options, and thus will help you in real NCLEX exam, both for NCLEX RN and NCLEX PN aspirants. Let's start with first strategy for today. Avoid answers that assign medical diagnosis. Nurses don't diagnose. Options with definitive diagnosis are usually incorrect. For example, diagnose the patient with asthma is incorrect since nurses assess, not diagnose. Let's see a practice question to understand this much better. A 45-year-old patient presents to the emergency department with complaints of wheezing, shortness of breath, and chest tightness. The patient reports a history of seasonal allergies and recent exposure to a cat, which triggered similar symptoms in the past. What is the nurse's priority action in this scenario? The options given to you on the screen are: Option A, administer albuterol nebulizer treatment. Option B, assess the patient's respiratory rate and oxygen saturation. Option C, diagnose the patient with asthma. Option D, initiate intravenous corticosteroid therapy immediately. Let me reveal the right answer of this question. If you need more time, you can pause the video as well. The correct option is B, assess the patient's respiratory rate and oxygen saturation. Administer albuterol nebulizer treatment. This is not correct. Administering medications requires a provider's order, and nurses must assess the patient's current condition first to determine the need for interventions. Assess the patient's respiratory rate and oxygen saturation. Correct. The nurse's role involves assessment to gather vital data, which is critical for determining the severity of the patient's condition and guiding the next steps. Diagnose the patient with asthma. This is not correct. Nurses do not diagnose medical conditions. This is the responsibility of healthcare providers like physicians or nurse practitioners. Initiate intravenous corticosteroid therapy immediately. This is not correct. While corticosteroids may eventually be part of the treatment plan, initiating therapy without a provider's order is outside the nurse's scope of practice. Let's see another important strategy. Dismiss unrelated conditions. Responses focusing on conditions unrelated to the question scenario are usually incorrect. For example, in a question on hypertension, monitor blood sugar levels is likely irrelevant. Let's see a practice question to understand this much better. A 60-year-old patient is admitted to the hospital for uncontrolled hypertension. The patient reports occasional headaches and blurred vision. Current medications include a calcium channel blocker. The nurse is preparing to assess the patient's condition. What should the nurse prioritize in the initial assessment of this patient? The options given to you on the screen are: Option A, measure the patient's blood pressure and assess for signs of target organ damage. Option B, monitor the patient's blood sugar levels to rule out diabetes. Option C, perform a neurological assessment to diagnose a stroke. Option D, review the patient's diet for carbohydrate intake. Let me reveal the right answer of this question. If you need more time, you can pause the video as well. The correct option is option. Measure the patient's blood pressure and assess for signs of target organ damage. Measure the patient's blood pressure and assess for signs of target organ damage. This option directly relates to the scenario of uncontrolled hypertension. Blood pressure measurement and evaluation for complications, organ damage, are crucial priorities in managing this condition. Monitor the patient's blood sugar levels to rule out diabetes. This is not correct. Although diabetes can coexist with hypertension, this is not directly relevant to the scenario unless specified. The focus should remain on the immediate condition of hypertension. Perform a neurological assessment to diagnose a stroke. This is not correct. While a neurological assessment may be part of broader care, nurses do not diagnose stroke. Additionally, there's no indication of stroke symptoms in this case. Review the patient's diet for carbohydrate intake. This is not correct. Diet review may be helpful in long-term management of hypertension, but it is not an immediate priority in this acute scenario. Rule out contrary to ABC priority. Options that ignore airway, breathing, and circulation are often incorrect in critical scenarios. For example, check blood pressure before securing the airway in a trauma patient is incorrect. Let's see a practice question to understand this much better. A 30-year-old patient is brought to the emergency department following a motor vehicle accident. The patient is semi-conscious with shallow breathing, audible stridor, and a visibly displaced jaw. Vital signs show a blood pressure of 90/60 mH and a heart rate of 120 beats per minute. What is the nurse's priority action in this situation? The options given to you on the screen are: Option A, check the patient's blood pressure to assess for hypovolemic shock. Option B, secure the airway to address the patient's breathing difficulty. Option C, insert an intravenous line to administer fluids. Option D, perform a full head-to-toe assessment to identify other injuries. Let me reveal the right answer of this question. If you need more time, you can pause the video as well. The correct option is option: secure the airway to address the patient's breathing difficulty. Check the patient's blood pressure to assess for hypovolemic shock. This is not correct. While blood pressure monitoring is important, addressing the airway and breathing takes precedence according to the ABC priority framework. Secure the airway to address the patient's breathing difficulty. Correct. Airway issues with stridor and shallow breathing are immediate life-threatening concerns. Ensuring an open airway is the highest priority in this critical situation. Insert an intravenous line to administer fluids. This is not correct. Establishing circulation, IV access, is secondary to ensuring airway patency and adequate breathing in the ABC framework. Perform a full head-to-toe assessment to identify other injuries. This is not correct. A full assessment is important but should occur after the airway and breathing are secured. Ignoring airway compromise could lead to rapid deterioration. Let's see another important strategy. Look for contradictory statements. Options that contradict themselves or other choices are usually incorrect. For example, encourage fluid restriction and high fluid intake is contradictory and incorrect. Let's see a practice question to understand this much better. A 70-year-old patient with a history of congestive heart failure, CHF, presents with worsening shortness of breath, bilateral lower extremity edema, and crackles on auscultation. The patient's daily weight has increased by 3 pounds over the last 24 hours. What is the most appropriate intervention for this patient? The options given to you on the screen are: Option A, administer a diuretic as prescribed and encourage high fluid intake. Option B, restrict sodium intake and monitor daily weights. Option C, increase the patient's activity level to reduce edema. Option D, encourage fluid restriction and promote hydration. Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck. You've got this. Let me reveal the right answer of this question. If you need more time, you can pause the video as well. The correct option is option. Restrict sodium intake and monitor daily weights. Administer a diuretic as prescribed and encourage high fluid intake. This is not correct. This is contradictory. While diuretics are used to reduce fluid overload in CHF, encouraging high fluid intake would exacerbate the patient's symptoms, making this option invalid. Restrict sodium intake and monitor daily weights. Correct. Sodium restriction helps manage fluid retention, and monitoring daily weights is essential for tracking fluid status in CHF patients. This option is consistent with CHF management principles. Increase the patient's activity level to reduce edema. This is not correct. Increasing activity might worsen symptoms in a patient with significant fluid overload and dyspnea. This is not a standard intervention for acute CHF exacerbations. Encourage fluid restriction and promote hydration. This is not correct. This is contradictory. Restricting fluids and promoting hydration are opposing actions, rendering this option illogical. This question emphasizes the importance of identifying contradictory statements and selecting interventions that align with the clinical scenario and standard care practices. Let's see another important strategy. Reject answers with patient blaming. Responses that blame or lecture the patient are generally incorrect. For example, tell the patient they should have exercised more is unprofessional and likely incorrect. Let's see a practice question to understand this much better. A 55-year-old patient with a history of type 2 diabetes is admitted for poorly controlled blood sugar levels. The patient reports difficulty adhering to the prescribed diet and exercise plan, stating, "It's hard to stay motivated with everything else going on in my life." What is the most appropriate nursing response to support this patient? The options given to you on the screen are: Option A, you should have been more disciplined in following your diet and exercise plan. Option B, managing diabetes is your responsibility. You need to try harder to stick to your plan. Option C, it sounds like you're facing challenges. Can we discuss what's making it difficult for you? Option D, if you don't follow your plan, your complications will only get worse. Let me reveal the right answer of this question. If you need more time, you can pause the video as well. The correct option is option. It sounds like you're facing challenges. Can we discuss what's making it difficult for you? You should have been more disciplined in following your diet and exercise plan. This is not correct. This response blames the patient, which is unprofessional and non-therapeutic. It doesn't provide constructive VE support or address the patient's challenges. Managing diabetes is your responsibility. You need to try harder to stick to your plan. This is not correct. While diabetes management requires patient participation, this response is accusatory and lacks empathy, which can discourage the patient. It sounds like you're facing challenges. Can we discuss what's making it difficult for you? Correct. This response is empathetic, non-judgmental, and encourages open communication. It helps build trust and allows the nurse to assess barriers to adherence. If you don't follow your plan, your complications will only get worse. This is not correct. This response is fear-based and may come across as threatening or shaming, which is unhelpful and unprofessional. Let's see another important strategy. Dismiss overuse of unnecessary tests. Options suggesting tests not required for initial care are usually incorrect. For example, order a full MRI for a sprained ankle is overkill. A 25-year-old patient RAVs at the clinic after twisting their ankle while jogging. The patient reports mild pain and swelling but is able to bear weight on the affected foot. On examination, there is tenderness over the lateral ankle and no visible deformities. What is the most appropriate initial intervention for this patient? The options given to you on the screen are: Option A, order a full MRI of the ankle to rule out ligament damage. Option B, recommend the RICE protocol: rest, ice, compression, and elevation. Option C, schedule the patient for immediate surgical consultation. Option D, request a complete body scan to rule out other injuries. Let me reveal the right answer of this question. If you need more time, you can pause the video as well. The correct option is B, recommend the RICE protocol: rest, ice, compression, and elevation. Order a full MRI of the ankle to rule out ligament damage. This is not correct. An MRI is unnecessary for mild symptoms and the ability to bear weight. Initial care should focus on conservative management unless symptoms worsen or persist. Recommend the RICE protocol: rest, ice, compression, and elevation. Correct. The RICE protocol is the appropriate initial intervention for a mild ankle sprain. It addresses pain and swelling effectively without unnecessary procedures. Schedule the patient for immediate surgical consultation. This is not correct. Surgery is not indicated for a minor ankle sprain unless there is severe damage, which is not evident in this case. Request a complete body scan to rule out other injuries. This is not correct. A body scan is excessive and irrelevant for a localized injury, making this option overkill. Avoid do-nothing responses in urgent situations. Options suggesting no intervention in emergencies are usually incorrect. For example, wait and see if breathing improves on its own is likely incorrect in a respiratory distress case. Let's see a practice question to understand this much better. A 68-year-old patient in the emergency department is experiencing chest pain, shortness of breath, and sweating. The patient's ECG shows ST segment elevation and their oxygen saturation is 89% on room air. What is the nurse's priority action in this situation? The options given to you on the screen are: Option A, administer oxygen and prepare the patient for immediate intervention. Option B, wait and see if the chest pain subsides on its own. Option C, encourage the patient to rest and drink water. Option D, reassess the patient in 30 minutes to determine if the symptoms improve. Let me reveal the right answer of this question. If you need more time, you can pause the video as well. The correct option is option: administer oxygen and prepare the patient for immediate intervention. This option appropriately addresses the urgency of the situation by improving oxygenation and preparing for necessary interventions in a suspected myocardial infarction, MI. Wait and see if the chest pain subsides on its own. This is not correct. In an emergency like suspected MI, delaying treatment can worsen outcomes. Wait and see is never an appropriate response in critical scenarios. Encourage the patient to rest and drink water. This is not correct. Resting may help reduce strain, but it is insufficient in this urgent scenario. Drinking water is irrelevant to addressing the acute symptoms of an MI. Reassess the patient in 30 minutes to determine if the symptoms improve. This is not correct. Delaying reassessment in a critical condition can lead to deterioration. Immediate action is essential for the patient's survival. Let's see another important strategy. Rule out too many actions at once. Overly complex options with multiple interventions are often distractors. For example, oxygen, administer fluids, and draw labs all at once may be incorrect for prioritizing. Let's see a practice question to understand this much better. A 45-year-old patient presents to the emergency department with signs of dehydration, including dry mucous membranes, low blood pressure, 90/60 mmHg, and a rapid heart rate, 110 bpm. The patient is alert but reports feeling dizzy and weak. What is the nurse's priority intervention for this patient? The options given to you on the screen are: Option A, administer IV fluids to address dehydration. Option B, administer IV fluids, perform a full head-to-toe assessment, draw labs, and check blood sugar simultaneously. Option C, perform a neurological assessment to rule out other causes of dizziness. Option D, educate the patient on the importance of hydration and monitor for improvement. Let me reveal the right answer of this question. If you need more time, you can pause the video as well. The correct option is option: administer IV fluids to address dehydration. Rehydration is the priority intervention for a patient with signs of dehydration and hemodynamic instability, low blood pressure, and tachycardia. Administer IV fluids, perform a full head-to-toe assessment, draw labs, and check blood sugar simultaneously. This is not correct. While some of these actions may be important later, attempting to do everything at once is unrealistic and distracts from the primary issue. The focus should remain on stabilizing the patient's condition with fluids. Perform a neurological assessment to rule out other causes of dizziness. This is not correct. Dizziness in this context is likely due to dehydration. A neurological assessment would be secondary and is not the immediate priority. Educate the patient on the importance of hydration and monitor for improvement. This is not correct. Education is valuable but not appropriate as an initial intervention in an acute situation requiring immediate action. Let's see another important strategy. Beware of inappropriate delegation. Answers that suggest delegating tasks that require an RN are usually incorrect. For example, ask the nursing assistant to administer insulin is incorrect. Let's see a practice question to understand this much better. A patient with diabetes is admitted to the medical surgical unit with high blood sugar levels, glucose 450 mg/Dale. The physician has prescribed insulin, and the patient is also due for vital sign checks and assistance with personal hygiene. Which task is appropriate to delegate to the nursing assistant? The options given to you on the screen are: Option A, administer the prescribed insulin to the patient. Option B, perform a glucose check and report the result to the RN. Option C, assist the patient with bathing and personal hygiene. Option D, monitor the patient for signs of hypoglycemia after insulin administration. Let me reveal the right answer of this question. If you need more time, you can pause the video as well. The correct option is option. Assist the patient with bathing and personal hygiene. Administer the prescribed insulin to the patient. This is not correct. Administering medications, including insulin, is within the RN's scope of practice and cannot be delegated to a nursing assistant. Perform a glucose check and report the result to the RN. This is not correct. While nursing assistants can often perform point-of-care glucose testing, interpreting the results and acting on them is the RN's responsibility. Clarify the delegation policy per facility guidelines. Assist the patient with bathing and personal hygiene. Correct. Assisting with personal hygiene is within the scope of a nursing assistant and does not require the clinical judgment of an RN. Monitor the patient for signs of hypoglycemia after insulin administration. This is not correct. Monitoring for clinical changes and responding appropriately requires assessment skills and critical thinking, which are within the RN's scope, not the nursing assistant's. Let's see another important strategy. Eliminate actions outside scope of practice. Actions that fall outside nursing scope are typically incorrect. For example, prescribe antibiotics is outside the RN's scope. Let's see a practice question to understand this much better. A 30-year-old patient presents to the clinic with symptoms of a urinary tract infection, UTI, including burning during urination, frequent urination, and lower abdominal pain. The patient asks the nurse for medication to treat the infection. What is the most appropriate action for the nurse to take in this situation? The options given to you on the screen are: Option A, prescribe antibiotics to treat the UTI. Option B, perform a focused assessment and report findings to the healthcare provider. Option C, recommend an over-the-counter medication for the infection. Option D, advise the patient to drink cranberry juice as the primary treatment. Let me reveal the right answer of this question. If you need more time, you can pause the video as well. The correct option is option. Perform a focused assessment and report findings to the healthcare provider. Prescribe antibiotics to treat the UTI. This is not correct. Prescribing medications, including antibiotics, is outside the scope of practice for registered nurses. This is a task for a licensed healthcare provider, physician, or nurse practitioner. Perform a focused assessment and report findings to the healthcare provider. Correct. Conducting an assessment and communicating findings is within the RN's scope of practice. This action ensures the patient receives IV as an accurate diagnosis and appropriate treatment. Recommend an over-the-counter medication for the infection. This is not correct. While nurses can educate patients about over-the-counter options for symptom relief, suggesting treatments for an infection could imply a diagnosis which is outside the RN's role. Advise the patient to drink cranberry juice as the primary treatment. This is not correct. While cranberry juice may help prevent UTIs, it is not an evidence-based treatment for active infections and could delay appropriate medical care.